When you come into Medicare, you have some really big choices to make, and they can be absolutely complicated when you don't have any experience with Medicare or how to choose the best parts and what makes the most sense for you. The main choice you have right off the bat is, do you stay on original Medicare or do you go into a Medicare Advantage plan? A lot of people don't even know the difference between the two. So I'm gonna go over that right now. I'm gonna tell you exactly what I would choose for myself personally. And I'm Keith Armbrecht, founder of Medicare on Video. I help people across the country make the right Medicare choices. I can absolutely help you as well. Feel free to take advantage of all the information I have on my website. If you stay to the end, I'll show you how to download my free book, Medicare Made Clear, a great resource to keep on your computer or your iPad for now and in the future. It has basically everything you need to know about Medicare in that book. But right now, we're going to talk about that main decision you have right off the bat coming into Medicare. Do you stay on original Medicare? Do you choose a Medicare Advantage plan? So first off, what's the difference? Original Medicare is Medicare. It's Part A and Part B. If you stay on original Medicare, it covers most of your medical expenses, but certainly not all of it. It has a big deductible on Part A. It has 20% coinsurance on Part B. So if you have original Medicare, you'll probably get a Medicare supplement plan that covers the stuff that A and B do not. You would likely also get a Medicare drug plan that covers your prescriptions. So that is the original Medicare side. Now, Medicare Advantage is different. It kind of packages all that together. This is the stuff you see on TV, especially with the Joe Namath and the J.J. Walker and the William Shatner commercials, where they're just pushing you to go into Medicare Advantage plans. So a Medicare Advantage plan is run by a private insurance company. So it is not Medicare running it. They pay a private insurance company to take responsibility of your claims away from Medicare. So Medicare pays about $1,000 a month per person to a private insurance company to get them to take responsibility of your claims. So good for Medicare and good for the private insurance company. So the issue that I have with Medicare Advantage, because it then takes it to a for-profit type scenario where an insurance carrier is then making decisions on what is approved and what is not approved. So I'm going to tell you right now, personally, what I would absolutely do is I would always choose original Medicare. I would never choose Medicare Advantage. I do have another video. I'm going to talk about original Medicare here, but my other video right here, if you look at this card right up top, come back to this spot in the video, you can see the video I have on why I would never choose Medicare Advantage, and that's got just a ton of views. So it's certainly important information to understand coming into Medicare. So let's talk about original Medicare and why I would always choose to stay with original Medicare. And it's pretty simple. Number one is choice. With original Medicare, you don't have any networks. So you can go to any doctor, any hospital, anywhere in the country without asking permission. So there's not a network that you have to stay within. You can literally choose to go to any doctor that takes Medicare, any hospital that takes Medicare. Now, a lot of times you're going to go to your local area doctors and hospitals, but it's the time when something significant or terminal or something that is beyond local scope where you want to go somewhere and see a particular specialist, whether it's a heart doctor or a neurosurgeon or anything. If you want to go to New York, you can go to New York. If you want to go to California, you can go to California. Again, you don't have to ask for permission. So that is number one right off the bat, freedom of choice to do what you want to do with your healthcare. Now, hopefully, we're going to all stay healthy through our later years, and we won't ever need to go see some really super specialized medical doctor for whatever type scenario. But if you get a rare form of bone cancer or a rare heart condition where it's just not the best in your area, I want to be able to go wherever I want to go. So that's right off the bat, number one. Number two, with original Medicare and your supplement plan, there aren't referrals. You don't have to pick a primary doctor and then go see that primary doctor if you need to go to a specialist. So if you need to go to something like a cardiologist, you don't have to ask permission from a primary care first to go see that specialized doctor. So there are scenarios where they may want you to get a referral, but it's not a requirement. So that's one of the biggest complaints with Medicare Advantage, is having to jump through hoops to go where it is you need to go. So with original Medicare, we don't do any of that. We absolutely have the freedom to do what we want to do with our own health care. And then number two, pre-authorization. With original Medicare, again, you don't have to ask permission, and that can be very, very frustrating. You hear a lot of stories on Medicare Advantage where things are not approved. Doctor says we need to do this, but the insurance company says we're not going to pay for it. So, and it has a lot to do with CAT scans and MRIs and rehab and things of that nature where, if you do some Google review looking for Medicare Advantage, you'll see a lot of those stories. With original Medicare, it's simple. If your doctor says it needs to be done and it's medically necessary, that's it. You don't have to ask for pre-approval to have something done with original Medicare. So that's another main reason why I would always choose original Medicare with a supplement and likely with a drug plan. That's a little different story with the drug plan. So, some folks don't take any prescription drugs. They may choose to use, there are plenty of discount drug programs out there, but that's just a different conversation. But original Medicare gives you the freedom to go to any doctor, any hospital, anywhere in the country. You don't have any referrals to go from a primary to a specialist. You don't have any pre-authorization where you have to ask for permission. And then the last part of it is the super low out-of-pocket expense. So when you're on a medical plan, your out-of-pocket max is what's really important. And with original Medicare, so if you have A and B, and for instance, you get a Medicare supplement plan G, the only out-of-pocket you have for the year is the Medicare Part B premium. Right now, that's $233. So you're out of pocket for the year from January to January with original Medicare and a Plan G is $233. So if you got hit by a bus and you had a catastrophic year from January to January, it's going to cost you $233. I mean, that's almost crazy that they have it built so it's that low. Anybody coming into Medicare has a much higher deductible, a much higher out-of-pocket expense. But that's it on Medicare. So it's fantastic. If you have a Plan N, it's very similar. You have the same $233, and then in addition, when you go to the doctor, it's a $20 copay. If you go to the emergency room, it's a $50 copay. So that's not any big out-of-pocket expense. Now, Medicare supplements do obviously have a premium, and what we see is generally we're running pretty close to average about $100 a month. Some states are a little higher, some states are a little less. So whether it's G or N, our goal is to really get close to about $100 a month for that supplement. So if you go into a Medicare Advantage plan, a Medicare Advantage plan may have zero premium. So there may not be an upfront cost, but I can promise you very much a get what you pay for with Medicare Advantage. Now, it's also kind of pay as you go. So on Medicare Advantage, your out-of-pocket expense, where on that G is $233, on Medicare Advantage can be as high as $7,500. So that's difficult to do when you're in whether it's a catastrophic medical scenario or just a serious medical scenario, to also have a big out-of-pocket financial bill when you come out of the hospital. So reasons I would always choose to stay with original Medicare with a Medicare supplement plan. Number one, freedom. Pick any doctor, any hospital. Number two, no referrals. You can go to the specialist without having to take an extra trip, an extra couple of weeks to go to a primary first. And that's another crazy thing with networks of doctors. You'll find if you need to go to that specialist and you call for an appointment and they'll say, okay, our first opening is 2 months from now. But I'm sick right now. I need to see a specialist right now. But they're first available literally 2 months from now. And that's more standard than it is not standard. So certainly part to understand. And then, pre-authorization. Original Medicare, you don't have to ask permission. Medicare Advantage, you almost always. You can go to the doctor and they'll say, okay, well, first we need to run it by your insurance company and see if it's okay with them. That's crazy as well. If the doctor thinks you need it, you absolutely should have it done. And then the maximum out of pocket on original Medicare with a supplement, super low, super low. On a Medicare Advantage plan can be super high. So again, it all works. Just to me, the best, I would absolutely have my mother on original Medicare. I would personally be on original Medicare. It's just the choice that I would make. So I hope you found this helpful and gives you an idea on the difference between the two. Stay tuned right now and we'll show you how to download my book, Medicare Made Clear. You'll find that very helpful. Also, a little more information on stuff you'll find helpful. Stay tuned. I hope you have a fantastic day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll find very helpful is, first, download a copy of my free book, Medicare Made Clear. I put a lot of time, a lot of effort into this book. You'll find it very helpful for everything that you need for Medicare now and in the future. It has videos in the book, has all the links that you need for signing up and everything else that you'll need going forward. So take just a minute, go to MedicareOnVideo.com/free book. You can download it right now and save it on your computer. You'll have it for now and in the future. And then down the road, when it's time to renew your Medicare supplement plan, we always want to shop around. So every year, it makes sense to do a Medicare price check. And I have a website specific to that, www.medicarepricecheck.com, where we will compare your current plan and see if we can get the same plan at a lower price. And a lot of times, we can do that. So it makes sense to visit MedicarePriceCheck.com every year. We'll do a quick comparison, let you know if it makes sense, and then we take it from there. I hope you found all this helpful. Have a fantastic day. Hey, don't go anywhere. These are some of my most recent videos right here. You can also find the link right below this video to download my book, Medicare Made Clear, absolutely free. You can also subscribe to my channel right here. So please, download my book, watch some videos, subscribe to the channel. Have a great day. Hey, don't go anywhere. These are some of my most recent videos right here. You can also find the link right below this video to download my book, Medicare Made Clear, absolutely free. You can also subscribe to my channel right here. So please, download my book, watch some videos, subscribe to the channel. Have a great day.